Parents often struggle with knowing how to talk about mental and behavioral health issues with their children, regardless of their age. There's a few tips I'd like to give to parents so that they feel like they have the tools to begin that conversation. They can be flexible about how this conversation happens. A child may benefit from a more formal sit-down or a more informal conversation in the car while you're driving to practice. For a younger child, while they're playing or doing a quiet activity, that may be a great opportunity to sit down and ask them some questions about how they're feeling. Make sure that there are no screens on when they're having this conversation because you want to make sure that you have your child's full attention. Use open-ended questions. These are questions that will hopefully elicit conversation, not just yes or no answers. What was the best part of your day? Or what was the most difficult part of your day? When your child begins sharing their feelings, parents can validate and acknowledge those feelings. That means regardless of if they are positive or negative, and just letting your child know that you're there for them and that this is a safe place to share those feelings. It's also important that if your child brings up a problem, that instead of trying to fix that for them, work with them to find a solution. This helps your child feel empowered and like they have the ability to solve their own problems. Parents also really serve as a role model here. This is a great time for parents to share their own feelings, how they've dealt with problems in their lives, and even for some parents who may have a mental illness themselves, depending on your child's age, this may be an appropriate time to also share that information and have dialogue around that. This really helps to normalize sharing your feelings and talking about these types of difficult conversations. It's really important to be having conversations around mental health. This should become a normal part of your family's routine so that parents and caregivers are regularly checking in with their kid about how they're feeling. I think it's even more pertinent now than ever that parents begin that conversation with their kids and find the time and the words to do so.